So in this video, we are going to discuss about the MCQ in which an image is kept and some question is asked based on that image. So let's see about the questions. The first question is, area which is circled is an artery branching from external carotid artery. What pulse can be felt here? Okay, that is the area circled here is the zygomatic part. Okay, zygomatic process, and the pulsation that is felt here is the superficial temporal artery pulsation. Okay, this is the artery that has been marked. Okay, it is felt over the zygomatic process. Arrow mark present between the condyle and coronoid. So this is the condyle or head. This is the condyle or head of the mandible, and this is the coronoid process. The notch between the two is called as sigmoid notch, whereas the notch present here is called as the coronoid notch. Which part of the tongue is associated with sweet perception? The tip of the tongue. Okay, the tip of the tongue is related to the sweet. On the sides it is sour, and here it is bitter. This region is bitter. The next question, tendon of which muscle glides around the pterygoid hamulus? So in this image, this is the pterygoid hamulus. Okay, this part that is related to the lateral pterygoid plate. There is one tendon that will hook around or glide around this hook-like structure. The tendon is tensor veli palatae. This is also the muscle responsible for palatine aponeurosis. What is the function of muscle marked in this picture? This is the only muscle in the picture. What is its function? This muscle is the lateral pterygoid. How did we identify? Because it inserts into the neck of the mandible as well as into the capsule and articular disc of temporomandibular joint. What is the function of lateral pterygoid? The only muscle that helps in opening of the mouth or depression of the mandible is the lateral pterygoid. Okay, all the other muscles of mastication help in elevation of the mouth, the mandible. Identify the cartilage. So this is a histology image based question. Here the cartilage we can identify with one key feature. If the cells are grouped, then it is hyaline cartilage. Okay, if the cells are arranged single, it is elastic cartilage. And if the cells are present in a row, it is fibrous cartilage. Okay, if it is in group, it is hyaline cartilage. If it is single, it is elastic cartilage. If it is arranged in a row, it is fibrous cartilage. What are the cells of the cartilage called as? Chondrocytes. Identify the epithelium. It is arranged only in one layer. So it is a simple epithelium, and the width of the cell matches the height. So it is a cuboidal epithelium. If the width of the cell is more than the height, it is squamous, and if the height is more, then it is columnar epithelium. The next one, which of the following muscles help in closing of the mouth? I already mentioned the only muscle that helps in closing of the mouth, opening of the mouth, is the lateral pterygoid. So this is the muscle that helps in opening. This is the only muscle that helps in opening of the mouth or depression of the mandible. Okay, so all the other muscles mentioned, the temporalis and the medial pterygoid, A and C, are the muscles that help in the closing or elevation of the mandible. The side of the neck is shown and the four components of the anterior triangle is marked. Dizziness and fainting is because of the carotid sinus syndrome, because of hypersensitive carotid sinus. This is a content of carotid triangle. This is the carotid triangle bounded by the posterior belly of digastric, superior belly of omohyoid, and the anterior border of the sternocleidomastoid. So see, here is the carotid triangle in which the carotid sinus is present, which is correctly mentioned. So these are all pes anserinus, the 5 terminal branches of the facial nerve. The uppermost one is the temporal branch. Followed by that we have the zygomatic branch, and then we have the buccal branch, and then the marginal mandibular and cervical. Okay, in this, one is correctly named as temporal. The 2 is named as buccal, but it is actually the zygomatic branch. So this is wrong. And 4 is named as cervical, but it is actually the marginal mandibular branch. And the 3 is named as marginal mandibular, but it is the buccal branch. Okay, so these 3 are wrong. Only the first pair is the correct option. Which is not tributary of internal jugular vein. So the internal jugular vein has the following tributaries. The first tributary to the internal jugular vein is inferior petrosal sinus. Followed by that, we have common facial vein, lingual vein, superior thyroid vein, middle thyroid vein, as well as occipital vein and communicating veins between the internal and external jugular vein. So the anterior jugular vein is not a tributary of this. It can either drain into external jugular vein or it can drain into the subclavian vein. The next question is artery which lies deep to pterion. So for that you should know what pterion is. It is a H-shaped structure that is formed by the joining of frontal bone, parietal bone, squamous part of the temporal bone and the greater wing of sphenoid. It is this junction. Deep to that we have the anterior or the frontal branch of the middle meningeal artery. This will be injured and it causes epidural hematoma. In case of a blunt force trauma to pterion, it causes hematoma. Identify the structure shown deep to this structure. So, this is the mastoid process. What is the content of the mastoid process? Mastoid air cells are present within it. It is related to the posterior wall of the middle ear cavity. Motor supply to intrinsic muscles of tongue. All the muscles of tongue are supplied by the same nerve, which is the 12th cranial nerve or the hypoglossal nerve, except for only one, that is the styloglossus. Styloglossus alone is supplied by 10th cranial nerve through the pharyngeal branch. Lingual loop of the lingual artery. So this here is the lingual artery. Okay, it is related to two structures, the 12th cranial nerve and the tip of the greater horn of the hyoid bone. It has the loops so that the hyoid bone can move. It is closely related to the tip of the greater horn of hyoid bone. So free movement of hyoid is facilitated by the loop of the lingual artery. Which of the following is the most characteristic feature of the cervical vertebra? So this is a cervical vertebra. The most characteristic feature is this foramen, that is called as the foramen transversarium, and the vertebral artery will pass through this foramen. It will ascend up the neck to enter into the cranium. Muscle contributing to the formation of palatine aponeurosis. So it is a part of the soft palate. The palatine aponeurosis is part of the soft palate and the muscle contributing is the tensor veli palatine. This is also the muscle that glides on the pterygoid hamulus. At the at the angle of mandible, which artery is palpable? So this here is the angle of mandible. Okay. And it is a junction where the ramus of mandible meets the body, and close to this you have only one artery that is tortuous in nature. So what is the artery? It is facial artery related to the greater horn or the greater horn of hyoid will be lingual artery. Injury to facial nerve at the level of stylomastoid foramen will lead to. So this is the stylomastoid foramen. After this, it only gives out muscular branches to posterior auricular, occipital, stylohyoid, posterior belly of digastric, and the 5 terminal branches, the temporal, zygomatic, buccal, marginal mandibular and cervical branch. So all of these nerves will supply the muscles of facial expression. So only this will be lost. The stapedial reflex is patent because the nerve to stapedius is emerging way before it exits the stylomastoid foramen. Similarly, the supply to lacrimal and salivary gland is also patent. So that is about the injury to facial nerve at the level of stylomastoid foramen, based on which branch arises from which part of the facial nerve. You have to identify what are all the possible symptoms. So in this section, we discussed about the questions for which a image is also included. So any structure can be marked in the image and you can be asked to identify that part, or a question can be based on the identified part of the structure. Thank you.